My name is Bill Denahan. I'm the very proud and happy CEO of the Alcohol, Drug Addiction, and Mental Health Board. I'm proud because of the job you do, and I'm happy because you are here this morning. Let's give yourselves a big hand.
In May of 2017, William Denahan participated in his last annual meeting as CEO of the ADAMHS Board. After many decades as a public servant, 15 of those with the ADAMHS Board, Mr. Denahan had chosen to retire. The Board of Directors had chosen then Vice President of Operations, Mrs. Harper, to fill the role of Chief Executive Officer. Over the next few months, they worked together preparing for the transition. On August 1st, 2017, Mr. Denahan retired, and Mrs. Harper began her role as the CEO. Times were changing, and Mrs. Harper was prepared to serve the county with passion and compassion.
Sitting next to him, Valeria Harper. She is the new Chief Executive Officer of the Alcohol, Drug Addiction, and Mental Health Services. Congratulations.
Thank you.
She's been an ADAMHS Board employee for the last 30 years, and in this new role, she's responsible for overseeing 444 treatment beds for men and women throughout the county.
Her commitment to individuals living with mental illness and addictions was easy to see in all that she did and said. One of her highlights was the unveiling of the beautiful mural on East 55th Street. The aims to reduce stigma and bring addiction awareness to the fact that treatment works and people do recover.
We're using it as one of our tools to stimulate conversations around addiction.
She called on President Trump to provide additional funding to the board and all frontline workers facing the epidemic when he declared the opioid crisis as a public health emergency. In an email to staff in late December of 2017, Mrs. Harper wrote, "I found myself reflecting on the past 5 months and the honor that has been bestowed unto me as the team leader for such an awesome group of dedicated team members. While there have been some significant reductions as a result of our limited funding this year, I remain confident that there will be new funding opportunities, enhanced collaborations, and the development of new partnerships in 2018. In order to achieve these goals and beyond, it will take all of us working together as a team. There will be many opportunities in the coming year to become more involved with the various systemic changes. The implementation of behavioral health redesign, expansion of prevention programs, analysis of the crisis service continuum, and refocusing on the needs of persons living with mental illness and their families." That was the last email the whole staff received from Mrs. Harper before her untimely passing in early January. The community came together in support of the ADAMHS Board and to help us grieve and move forward. For that, we are so grateful. Scott Osicki, while mourning the loss of his colleague of 24 years, friend and mentor, stepped up to manage the changing landscape during this difficult time. He relied on a team of dedicated professionals and the guidance of a compassionate and wise board of directors. In March of 2018, the board of directors unanimously appointed Scott as the Chief Executive Officer of the ADAMHS Board. As we look toward the future, we know that more changes are coming. Scott's vision is to work collectively to create a system of care that is guided by wisdom, where decisions are made with clients in mind and supported by data. A system that supports collaborative community efforts and partnerships with managed care organizations, where there is compassion and hope for all people living with mental illness and/or addiction. And finally, a system that is appropriately funded to meet treatment and recovery needs. We know that we cannot achieve this alone, but we believe that our board of directors, CEO and staff, clients, families, faith-based leaders, legislators, providers, and strategic partners with community, nonprofits, and local businesses will help us transition to an organization that is leading a truly recovery-oriented system of care. This is the time for the ADAMHS Board and the community to view changes as the opportunity to continue to tackle the opiate epidemic, help individuals living with mental illness and/or addiction, reduce stigma, and provide a healthier life for the residents of Cuyahoga County.